Knock, knock, knock. Hi, my name is Taylor. I'm going to be your nurse for today. Can you just verify your name and date of birth for me? Okay, Daisy Duck. Perfect. You know what procedure you're having done today, Miss Daisy? Yes, you're having a urinary catheter. Do you have any questions about it before we begin? Do you have any allergies to betadine, latex, or tape? No? Okay. Is it okay if I wash my hands and get started? Okay, perfect. So I'm gonna wash my hands to provide the curtain for privacy, and I'm gonna set down my things. First thing I'm gonna do is pull back your sheet here. I'm gonna place your legs. I'm gonna provide peri-care with a clean set of gloves. Then I'm going to take off these gloves, wash my hands, and then we can get started. For the sake of my exercise here and showing my sterile field, I'm going to move my patient out of the way. So the first thing I'm going to do is take this out of the case. I'm going to put my trash off to the side here. I'm also going to move my chair. For the sake of the exercise, these are going to be put those there. I'm going to square this part using my 1-inch borders. Now, what I'm also going to do, move these gloves to the side. Move this to the side. I'm going to grab my blue drape. I'm going to use the 1-inch margins, placing the shiny side down underneath my patient's legs. Of course, for the sake of the exercise, cannot do that, but I can verbalize it. So I placed the blue sheet, which one I will do after I finish my sterile field. I'm gonna put on my gloves. First thing I'm going to do is come in, scoop up with my right. There we go. Come here, get my left. Okay. Now I'm going to come over here. I'm going to use my loop, put a little bit right here, discard into my trash bag. I'm going to slowly take off the wrapper of my thing. I'm going to stick it in my loop, drop my trash so that I don't break sterile field. I'm going to come over, get my alcohol wipes, and put these in my box, dropping that to the side, keeping my hands close in, grabbing my syringe. Tightening that there. Moving this to the side. That way everything is in my box and it's ready to go to the patient. For the sake of the exercise, yes, I'm keeping my sterile field, but I'm moving this all out of the way just for moving my patient back so I can demonstrate the thing. So we're gonna pretend like I came over here and this was already set up and I did not break sterile field. Move that out of the way. Okay, so pretend like I just moved the box to the patient. So I'm going to put my hand here. This hand is not going to move. I am going to clean. Distally, come around, drop. proximally, come around, drop. Medially, come around, drop. Now we're good to place our catheter. So I'm going to come here. I'm going to thread in the catheter. For the sake, it's going to go right there. Once I'm threading in, I see urine. Perfect. I'm going to go 1 to 2 inches past that, and I'm ready to inflate my balloon. Going to inflate my balloon as such. I'm going to uncap my syringe. I am going to let go. I'm going to do a slight tug. Perfect, it is in place. I'm going to remove my gloves, wash my hands, provide pericare, and then I'm going to secure the bag to the side of the bed. And then to remove, I'm going to come back in, get clean gloves. I'm going to attach my syringe back to the port, draw up my, or deflate my balloon. Then I'm going to unhook, pull out, make sure that the end of my tip is intact, which it is. Then I'm going to discard properly and document. Thank you so much and have a great day.